Hi, I'm Dr. Sarah Wasserbauer, and I'm here today to talk to you about something that's really important, but not always easy to talk about and look at. So let me share my screen here, and we're going to talk about the ugly side of the hair transplantation industry. So this has been going on for quite a while. As a matter of fact, this presentation was put together 2 years ago in response to a lot of new and worsening patient complications that have been coming to hair doctors around the world. And before I go into this, I wanted to let you know that the ISHRS is a global non-for-profit. It is kind of the parent organization for doctors who are really interested in doing excellent hair transplant surgery and educating each other, sharing knowledge, really optimizing the best clinical outcomes for all of our patients. And it's actually more like 1,200 doctors worldwide. Not a lot of doctors do this for a living, but there's about 1,200 doctors worldwide throughout 70 countries. So it's a very international organization. And their one goal is to, do what's right for patients. So they have really high standards, and they're the one who usually do the most educating for doctors in our specialty. So this presentation is to raise awareness of what's been going on in our hair transplant field, and possibly and hopefully to educate patients, whether it's through ourselves or through educating somebody else who then educates patients about the potentially unethical practices that are going on around the world, particularly in certain countries when people are going for hair transplants. So if you want to find out more about this, the ISHRS thought it was important enough to actually start a campaign and fight the good fight about not doing cheap, poor quality, substandard hair transplants that would scar and otherwise really disfigure patients, because we really started seeing this in 2014. So in 2014, the people started to trickle in where we were seeing hair transplants done by non-physicians, which, as you might imagine, is completely illegal in most jurisdictions. It has to be done by a physician. Only a physician will be trained to do this. But in a lot of places, it was being done by people who were not physicians, who were just hair technologists. Anytime you incise the scalp or move tissue on a human being, you need a licensed medical doctor. And in some jurisdictions, this can be a nurse practitioner or someone's called a physician assistant, but that's severely restricted. And if that is delegated, if that incision process is delegated, it has to be according to medical guidelines. And there's certain places that allow it and certain ones that don't. But in any case, the surgeon themselves has to know what it is that they're doing. They can't just delegate it and say, okay, my physician assistant is going to be doing this. They need to know what that whole procedure is, be able to do it from beginning to end, and then they can delegate portions of it. So there's two types of surgery that we're talking about here. I'm going to move myself over to this side. One is follicular unit transplantation, called strip harvesting. FUT actually stands for follicular unit transplantation. And all of this being done right now is actually follicular unit transplantation. But there's linear excision harvesting, that's also known as strip harvesting, and follicular unit excision harvesting, where you're taking out one graft at a time. So each option has its benefits for the patient, but mostly you need a surgeon who knows how to do both, preferably, to be able to tell you what the benefits would be for you in your individual case as a patient. So ultimately, it's the doctor's responsibility to recommend something that's going to work well for a patient. And I'm not sure why this is not going. But the reason that we have a doctor doing this is because you want your hair transplant results to look natural, completely undetectable. It should not. If a hair transplant is done well, you shouldn't be able to tell. Nobody should be walking up to you and saying, "Hey, man," or "Hey, woman, nice hair transplant." No, then I've done a terrible job. So this is, an example of one of mine, but it's just by way of showing you that it should not be visible to the naked eye. Okay. Now, there is increased demand worldwide for hair transplant, and a lot of patients are thinking, oh, this is a minimally invasive procedure. I don't have to lose my hair. There's no linear scar, or no, sometimes they think there's no scar at all. There's no sutures. I just come in, I'm out. Maybe I just get it done in a day, and then I've grown my hair for the rest of my life. And a lot of this is due to the surge in popularity of the FUE technique, because people perceive this as being minimally invasive. It's been advertised this way. And a lot of surgeons have gotten training in this technique and think that they can do it without, anything more than like a weekend spent with another doctor in a clinic. In addition to that, a lot of the FUE machine manufacturers have been pushing this turnkey model. Turnkey just means that I buy the machine and it can start making money. I turn the key and it's like, your car starts up and it gets going. So they sell these devices in addition to the staff to do the procedure. But as I explained before, that's completely illegal. Plus, it's unethical. If you're going to a surgeon to do a surgery, the surgeon needs to be doing the surgery. So some technicians with no experience in hair transplant surgery are following this model and performing hair surgery in cases where they shouldn't at all. So physicians who perform this, and this is the position of the ISHRS, I'm not speaking on their behalf, I'm just saying, I'm using them as an example to show what an organization that really knows their stuff is saying about this procedure. So physicians who perform it must possess the education and training and the current up-to-date competency in the field of hair restoration in order to be able to do that. Otherwise, it's beyond the scope of practice. So doctors use this to say that you may be a doctor, but unless you know and you're trained to do something like brain surgery, you shouldn't be doing brain surgery, and you need to self-police. If this is not something that you have extensive training in, that you can guarantee that you can speak with authority, you're not guaranteeing results, but you know what you're talking about and you've done enough on it, usually under the tutelage of somebody else, then you should not be doing it. And you should know that it's outside of your scope. So for instance, when I was a general internal medicine doctor, I would not have been performing hair transplant surgery or brain surgery. I mean, brain surgery is the easy one to kind of go through. So let me move this on to the next one. So in certain countries, there's, certain things are more allowed than others, but across the board, it should be a physician who's performing this. And there's a lot of non-doctors who are performing surgery. Sometimes you go to a clinic and it's advertised that there's a doctor there. Sometimes there's no doctor at all. I have a picture of this. Sometimes one doctor for 60 patients who are getting their hair transplants. And this is unlicensed technicians, not necessarily in very sterile surroundings, performing the doctors. And they're just hiring the doctor to be there, kind of the name on the door. And there's technicians who are offering to travel from country to country, which is actually really bad in the case of an epidemic like we're having right now, to do the surgery for a doctor. And then they bop back to their home country and they're never there when the complications come in. Usually the complications come back to a legitimate doctor like myself, who is seeing, tons of these come through the door. So you have to be able to know who is doing your surgery in order to go back to them if there's a problem. So it's beyond the scope of practice for a non-licensed personnel to be able to do this. And I think I've already made that point. So the company that sells the FUE device to the doctor then sends out the unlicensed technician. This is the turnkey model that I was talking about. Once again, the doctor is present in name only. They haven't been trained on how to use these devices. What they were sold is, and this happens with a lot of plastic surgeons, God bless them, excellent plastic surgeons who've been sold that this is a perfectly legal way to do hair transplant surgery. You can do a couple of hair transplant surgeries a month and it's just going to be money to you. Our transplant technicians are going to take care of this for you. All you have to do is advertise that you do this procedure. And all of a sudden, you're going to get an extra 30 grand or whatever it ends up being. It's a turnkey procedure. Well, that's unethical and it's illegal, actually. So the number one destination, particularly before COVID, was Turkey, but Pakistan, India, Iran, even in the United States, even in my jurisdiction out here, not jurisdiction, but even in my area out here in the San Francisco Bay Area, there's doctors who I know and can name who are getting away with this. And they're legitimate doctors. There's nothing wrong with being a legitimate doctor, and there's nothing wrong with these doctors doing surgery if they had the training and if they were doing it themselves. But instead, they're bringing in these technicians who are doing the whole surgery and don't have any ethical or legal authority to be doing so. So there's a huge internet marketing presence. People come to me and they say, well, I did my internet research. Unfortunately, there's a lot of misleading claims and nobody is policing this on the internet. So there's no pain, no scars. Leading world expert. Well, it takes nothing to call yourself a leading world expert online. And there's no distinction for bad or good candidates for this surgery. So there's no assessment of whether or not the patient themselves is actually reasonable for that surgery. So that's what a doctor is trained to do, to assess whether or not it's reasonable for this patient to actually go through this type of surgery. So technicians, not doctors, perform the surgery, the anesthesia. Sometimes they make the patient fall asleep and then they start the surgery so the patient doesn't know who did their surgery or did what. And if there's a negative outcome, well, then they can't witness. They can't say who did their surgery or say anything. Now, all they have to rely on is the word of that unethical doctor or those unethical technicians for what exactly went on. This allows the doctor in question to, undercut legitimate doctors and charge cheaper prices, but you're not getting the quality of surgery that you would expect. And sometimes the grafts don't even grow. So now you're out the money and you're scarred and you have no recourse. So the clinic may have no doctor or one doctor supervising, way more patients than they have a right to. They attract patients by offering large numbers of grafts, 5,000 grafts. That's usually the number. 5,000 seems to have a nice ring to it. For a very cheap price, $1 a graft, or $1,000 for 5,000 grafts. And they also advertise it as a package deal. It's a 5-star hotel. Come on over and we'll take care of you. The doctor will do your surgery and then we send you out on the town with a voucher and we put you up at a hotel and then we'll pay for your flight back. They offer a certification of quality, which I could print out on my printer tomorrow. And they guarantee results. No doctor would guarantee results. That's unethical to do. Because how do I know that an infection is not going to happen? How do I know that grafts are going to grow for absolute certain? No doctor would ever say that. Now they can say that, if there's a problem with my work, I will fix it. And that's what an ethical doctor would do. But you can't ever say as a doctor that you're guaranteeing something that's going to happen, because that's why they call it the practice of medicine, not the exact science of medicine. An ethical doctor is going to give you reasonable expectations about what the possible complications could be. So here's one of those nasty photos. The first time I saw this photo, I thought, oh, wow, how wonderful that that all of these females are now doctors in this country. And as you can see, these patients are right next to each other. This is not sterile between one person and the next. And none of these are doctors, unfortunately. I wish we had that many female doctors represented in the country in question, but they are not. And it makes me sick to see stuff like that. It was a suck in of breath and a deep, horrible feeling in the pit of my stomach, like I was getting called to the principal's office. That's how this kind of photo makes a doctor like me feel. And the following are not the greatest photos. So steel yourself, but I think you need to see what's going on in these clinics and what shows up, the day after. Severely depleted donor areas. Somebody should not have had this much taken out. This is what it looks like when this patient has a healing. No hairstyle will cover this. Scalp micropigmentation might help. I mean, we've been using that quite a bit. But if you don't have any hair on the back of your head and the back of your head looks like this, it doesn't matter whether the top of your head looks like you belong to the band Flock of Seagulls, it's not going to look right. Excessive trauma, over harvesting. These people were promised no scarring, and this is what they're ending up with. And the problem with these patients is once they have killed all of the hair in this area, not the patient themselves, but once the clinic that they've gone to, clinic in quotations, has killed all the hair in this area, it is very difficult for a surgeon like myself to find additional hair. They've depleted their reserves. So they've drawn down the bank account. There's not a lot there. And I'm not talking in terms of financials. I'm talking about in terms of the hair bank account to restore some of this. So the patient is really in a pickle. And you have to have some hard conversations about there's not a lot left that we can do. These are bad results on women. Should never have been attempted. This is an example of a non-scarring procedure. This is not a non-scarring procedure. These little white dots are very evident. They say, oh, you can shave your head and nobody will ever see anything. This is not how this surgery should look. These are also examples of people putting hair, this hairline is way too low. They've left a gap between, this is their normal hair loss here. And not all the grafts have grown. You see how patchy this is. This one is too. You can see that this is where the normal hair loss is. The patient wanted this whole area filled in, and this is the sparse result that they've gotten. If this came into my clinic, I would be, number one, horrified, and number two, frustrated that they had spent all that money and time to get such an inferior result. This is never going to look normal. You kind of have to start from scratch. You get infections. Infections are horrible to look at. It definitely leaves scars, necrosis, overuse of epinephrine, outdated transplant techniques. You may not need to go through all of this, but this is some of the stuff that you have to do in order to get rid of these hairs at the hairline that just look absolutely horrible. It's not supposed to be this low. There's 2 and 3 hair follicular units at the hairline, which, you know, if you're a trichologist, you know that never exists in nature, unless it's, you know, something odd. These are eyebrows that were done that are just, you know, horrific. And all of this misleading advertising leads people to think, oh, they're going to get this amazing result. It confuses patients. They can't make a decision about what is a good, reasonable surgery, especially when they're being basically sold. They're being taken emotional advantage of. And we all know that hair loss is an emotional time. If people are going through hair loss, they'll pay anything to get their hair back. And this has been going on in our industry for years. I mean, even going back to the ancient Egyptians, people want their hair. So they're emotionally vulnerable, and it's completely unethical to take advantage of them and tell them that you're going to give them something that you won't. So to conclude, hair transplant, it's a surgical technique. It is not easy to perform. It depends on the surgeon's skill level and their training. And bad things can happen. So it's unethical to be done by an untrained professional. And technicians who help with these surgeries, they're not the doctor. They're not making the judgment call, no matter how good they are, how much experience they have in their field. There's certain roles that need to be filled by people who have the training to fill them. So they are not able to deliver the same level of care. And if somebody were to go through, you know, a complication, you need the doctor there to know what's going on, be able to diagnose and prescribe the appropriate treatment. So if you want to learn more about this, this is the ISHRS.org Fight the Fight campaign. There's a lot of great detail and case studies. And hopefully, if you get a patient who's looking to maybe go through some of this, you will be able to point them to the right resources to show what can happen. And hopefully we'll be able to stop this horrible thing from going on around the globe. I hope this really helps. Please spread it around to your patients, and let's seriously fight the fight, fight the good fight for our patients. Thanks so much. Bye-bye.